Dear colleagues, I continue my project, analysis of article, and now it's article number 3. It's fresh article published in Journal of Endodontics this year, 2024. And what we can see from the name, this article about using of special ultrasonic tip, Flatsonic, that can optimize removal of remaining thinning material in flattened root canal. I just want to remind you that flattened canal, it's canal that different distance have a difference at least 4 times. It's much more flattened than long oval that have a difference 2 times or 2.5 times. And what we can see, we understand from this picture that we have 2-step retreatment. First retreatment, that can retreat some material from inside, and some additional procedure that do it better. And from the name of article, we understand that the best approach is Flatsonic tips. And now we will see the article, and we will see the conclusion of authors, and we will decide if we agree with this conclusion or maybe not. Okay? What they used in this article, they use 2 types of additional supplementary technique. One of this technique use this Flatsonic ultrasonic tip look like arrow. And second, use instrument that we know very well, XP Finisher R retreatment. Okay, what the significance of this article? In significance, with the interesting sentence that presence of remaining thinning material can negatively influence endodontic prognosis. First of all, I am 100% with this sentence, but it's not the, it's not the conclusion of this specific article. We know it. The second sentence, that Flatsonic ultrasonic tip demonstrated effectiveness and safety as a supplementary protocol during the retreatment of flattened root canal. Okay. What about conclusion? We now will see the conclusion of author. The conclusion that Flatsonic ultrasonic tip is more effective than XPFR in removing remaining thinning material in flattened root canal and can be considered an excellent option for retreatment of canal filled with bioceramic sealer. Whoops. First time we see that here during retreatment, tooths were obturated previously with bioceramic sealer. It's important. An interesting last conclusion. Both complementary cleaning methods, ultrasonic tip and XPFR, were similar in apical third. No difference in apical third. We will see it. When I speak about this new tip was designed in Brazil. It's stainless steel ultrasonic tip with length 18 millimeter, and we know sometimes it's with the crown, and the roots much longer. Taper 0.1, I think this non-working part with taper 0.1, and the size of tip that look like arrow, it's 0.25 millimeter, like file number 25. Okay, what we know about XPFR, XP and the finisher treatment, that's night-eye instrument done from max wire alloy that in the temperature of the body in the canal plus 37 degree will be curved a little bit, and during rotation of this curvature part will try to remove some remaining filling from the wall. The diameter of this instrument 30 and the taper 0. Okay, we know it very well. What they do in this research, first of all, they do a micro CT to choose the flattened canal, and they choose 24 mandibular molar with 1 flattened distal canal, okay? And they prepared with reciproc number 40, and after they use for obturation Tadger hybrid technique. Professor Michael Tadger was my teacher in Tel Aviv University in 1992, and he developed this hybrid technique that I will explain you now what is the technique and how they use it. They start with Bio-C sealer. Bio-C sealer, it's tricalcium silicate sealer, named bioceramics, and they put this sealer how it was recommended by company with syringe, and after they put a gutta-percha master cone. If we are speaking about tricalcium silicate sealer, this is a recommendation of companies, because company explain us that with bioceramic sealer, we can use a thick layer of sealer and just one gutta-percha cone. And this is the main difference with all other sealers that we try more gutta-percha and thin layer of other sealer like epoxy one. But see what they do here. They really use a Tadger hybrid technique. First of all, they started with lateral compaction. I have no idea why they call it lateral condensation. In apical part, they use finger spreader number 25, and middle cornal part, they use spreader number 30 with the accessory cones. And after the main part of the hybrid technology, they use condenser of Max Padden. In this specific case, they use the obturator, dense play obturator. You see Max Padden compactor that they put in low speed and the velocity 8,000 RPM. Okay, they put it inside and they continue with vertical compaction by heat plugger. They use this combination of cold and warm techniques. And as we know, all these combinations have one goal: to push soften gutta-percha inside of the canal. In the end, we have more gutta-percha and thin layer of sealer. It's exactly against the recommendation of companies. But again, you know, it's research about retreatment and not about properties of sealer. But it's interesting point, I think, personally, is this specific research. Okay. After that, of course, they weighed the week plus 37 degree, you know, with 100 humidity. They started retreatment procedure. In the first stage of retreatment procedure, they took reciproc file number 50, okay, and they retreat the gutta-percha out, and you see the results. These are the results, okay? And after they divide all teeth for two group, 12 canal in each group, and they continue in 12 teeth with Flatsonic, ultrasonic tip, and the second with XPFR. And you can see the difference. You can see the difference, and you know, already now you see the difference between ultrasonic and between XPFR. What's super important, in my opinion, in this article, that all this research was done with microscope, with magnification about 13. It's super important. Straight canal, and doctor see all the time what he's doing. It's very important, especially we know as practitioner, what we are working with ultrasonic tips, to see what I touch, what part of the canal I'm touching, because it may be very dangerous. We know it very well. Okay, what about the results? If we see this table, we understand after very simple calculation that after first stage, after using O reciproc number 50, they removed a little bit more than 50% of the root canal filling. 54, 55 residual material was inside after number 50. Maybe one of explanation is the form of the canal, that it's very difficult to work in super flattened canal with round and cross-section instrument. We understand it. But when we see table that they give us, we can see that in cervical and middle third, amount of residual material sometimes was more than 40%, more than 50% a part of the cases. But in the apical part, maybe because apical part is less, maybe because apical part not so flattened, we see that residual material was between 20 to 30%. Okay, we are continue now. And now we see the results of ultrasonic tip versus XPFR. And what we see, the difference was huge, statistically significant in cornal part and in the middle part. And with ultrasonic tip and coronal cervical part and middle part, we see about, I don't know exactly, but I think about 3–4% of remaining thinning material. But please pay attention on the apical part. In apical part, in both technique, we again between 20 and 30%. What they wrote in conclusion, the same efficacy? I am not agree. The same non-efficacy. Both instruments are not effective in apical third. By the way, when we really read the article, we can find in discussion in article that Flatsonic and XPFR did not improve the removal of remaining thinning material and the apical third. We can explain it by different factors. For example, maybe in apical part we have some curvature, it was impossible to work with our instrument. Maybe it's not so flattened and we can't improve it, but the fact both technique didn't work there. It's important for us. And for me also important part in discussion, it doesn't matter what supplementary technique we use, it's impossible to totally remove residual material. Also some interesting point that we see all the time, you know, this nice color inside. And we think that maybe it's all gutta percha, but it's not gutta percha. Part of this color is bioceramic. And maybe because bioceramic after setting, you know, like building cement, it's impossible for XPFR to clean it. And this is why we have the difference in coronal and middle part of the canal. Just, you know, very aggressive influence of ultrasonic tip can really remove it from there. Finally, my conclusion. I hear good skeleton and white color conclusion of author and some adding of me by yellow color. First sentence, my bioceramics, the calcium silicate sealer present a significant challenge to remove even in thin layer. This wasn't this work. Flatsonic ultrasonic tip combined with microscope, important, is more effective than XPFR in removing remaining thinning material in straight coronal and middle parts of flattened root canal with diameter 0.5. I have no idea about different diameters. It can be considered, I remove excellent, it can be considered an option for retreatment of those type of canal with bioceramic sealers. And of course, I changed the last sentence. Both complementary cleaning methods were similar ineffective in apical third. This is my approach to this article. I hope it's interesting for you. By the way, as always, my idea how to continue research. First of all, important for me as for clinician to compare this new Flatsonic ultrasonic tip with regular ultrasonic tips of different diameter with round cross section, because I'm with microscope in flattened canal can do brushing motion to clean this bioceramic sealer. Second, of course, I want to check curved canal. Maybe I know the answer, but I need research to prove it. Of course, important retreatment of the canal with lesser diameter, like 30–35. I don't want, you know, to widen the canal for using additional equipment. Doesn't make sense. And of course, epoxy sealer. What about epoxy sealer? We will see the difference with epoxy sealer. Meanwhile, for example, in Israel, in most of cases, I retreat cases with epoxy sealer. An important point. We know in the end of that microscope, it's amazing, it's important, but life is life. In many, many countries, in many, many clinics in the world, people continue to do endo with binoculars. It's important, I think, for clinicians also to check ability of safe work with this type of ultrasonic tips with binoculars too. I hope it was interesting for you. If yes, you can put your like and continue follow me with my new project. Have a nice day. Bye.